During the pandemic, the COVID-19, those were tough times for everyone. A group of people with disabilities came to our branch office in Ankara and didn't ask for any help. They want actually to help others. And they started by helping us pack food to give to those in need. And their enthusiasm was contagious, and it led to something bigger. Then we blinked, and in 2021, we officially started the barrier-free branch within our organization. And this group works right alongside our youth and women's structures. And together they show how much we can achieve when we truly include everyone. The idea behind the barrier free is actually simple but powerful for everyone. We are breaking down the barriers that stop people with disabilities from fully taking part in life. And our goal is to change the way people think about receiving and giving help. And our leaders in each branch are actually people with disabilities who are leading other volunteers to become involved in our volunteer actions. During that earthquake response, for example, our program leaders, our barrier-free leaders, use their networks to find out what disabled people needed the most, like medical support or mobility aids, and they made sure we provide these.
In our case, there is a very strong support at all levels. The governing board leads the Social Inclusion Commission, and we have a social inclusion policy. And in fact, inclusive Red Cross is a main goal across the organization. So all the departments must develop each year activities that promotes inclusion in all levels, at the internal level, right, recruiting volunteers, but also at external level with the community. These goals are tracked by a dashboard and are part of our national standards. We have a lot of volunteers that are paramedics, right? We have a big ambulance service, so we have a real need because they have to attend patients that they can speak in oral language, right? They need to speak in sign language. So we started an alliance with a private institution for learning sign languages and get certificated. And this has been very, very successful, but for all volunteers, not just paramedics. Currently, some of our volunteers that have already been trained, they are providing themselves short training, specific training for paramedics with some basic vocabulary concerning about things about health and diseases and symptoms and things like that, so they can communicate in their daily work with the patients.
And from these particular accessibility audit findings, we were able to quickly develop a framework based on the recommendations. And this, we had to partner hand in hand with the CBM Global, the Finnish Red Cross, as well as the Danish Red Cross, and also brought on board some of the local key players, which for this case includes the National Councils of Persons with Disability, as well as the other organizations of persons with disability within Kenya. So based on this, the first things first that we went and looked into was to review our disability mainstreaming policy. We had to make a number of commitments, again, based on the accessibility goal resource, again, by CBM Global. And our first commitment was to look at our workplace and our premises. They were supposed to be accessible for all persons with disability. And we looked at who will be responsible for this particular first commitment. And we had to do a number of trainings and sensitization among staff who have administrative and logistical responsibilities, as well as particularly those who are in charge of overseeing the HR, the budgets, which for this case include the senior management team, the programmers who are in charge of designing programs, and also went further into looking at our procurement systems to just make sure that they are a bit more inclusive, including a representation of businesses who have a specialty with disability mainstreaming. We have our fifth commitment, again, which has also been embedded into our policy. And this is with regards to the non-discrimination and accessibility for all services for persons with disability, regardless of their age, gender, faith, or even ethnicity. And this, we've seen it working, especially during our our current ongoing OND reigns, where most of the assessments that are being done, the rapid assessments, again, the findings are based on the SAD framework. For this case, we segregate data by sex, age, and disability segregation type, so that, again, we can be able to tailor-make interventions during our response for these particular vulnerable groups. Aside from that, we are also scaling up into bringing on board and working closely with the organizations of persons with disability, because it was part and parcel of us to, map them out so that we can be able to address our fifth commitment.
So I'm from Bangladesh Red Cancer Society and working as a PGI focal. We worked with the CDD, and that is the Center for Disability in Development. We started with CDD from 2018. This collaboration includes both emergency situations and long-term development programs. CDD actually provides technical supports and various types of training to better addressing the needs of people with disabilities. CDD's technical experts assist BDRCS in identifying the specific needs of people with disabilities and recommending appropriate assistive device and also the support. Based on the assessments, BDRCS provides assistive devices such as wheelchairs, portable chairs, sticks, glasses, hearing aids, and other devices to people with disabilities. Last in 2022 flood operations, we already provided this type of assistive devices.
OK. Alors, le changement d'abord en termes d'engagement, ça a commencé du moment où on s'est imprégné de leurs challenges sur le terrain, des difficultés qu'ils faisaient face sur le terrain, au-delà de l'évaluation initiale que nous avons fait au préalable. Et la deuxième des choses, c'était la replanification de nos activités suite à leurs propositions, parce que nous ont proposé, ils nous ont dit avant même de descendre sur le terrain, il est préférable que vous fassiez une formation. Dans cette formation, il faut inclure les personnes qui vivent avec handicap. Il y a des instruits parmi nous. Et la troisième des choses, c'est quoi? C'est qu'au-delà, avant même dans tout ce qui est processus de sensibilisation, il faut que la personne qui est porteuse d'handicap soit la même personne qui va aller envers les autres personnes qui sont porteuses d'handicap pour faire la sensibilisation. Donc, ça a idéalement changé au début parce que nous, on avait prévu que les volontaires allaient se déplacer pour aller, mais on a changé l'approche, on les a engagés. Donc, c'était ces mêmes personnes qui étaient formées, également parties aussi pour faire la sensibilisation.
I'm Dalal Al-Taji from Gaza. The persons with disability who have been in houses who have been bombed, they were unable to run due to either having a physical or visually or hearing disability that they can't hear what's happening. So unfortunately, their house gets bombed and they can't actually do anything, so they die. Some persons with disability have lost their families, so when they lose their security or their families, that's really a big issue. A lot of them are living in tents or in school, no basic life basics, not water, no electricity. If you could imagine 150 people, they talk about women now, 150 people are waiting for one bathroom in order to go to the bathroom. The other thing is accessibility. The evacuation tents or evacuation centers, whether they be tents, whether they're in hospitals, whether they're in schools, they are unable to move around due to that there's no accessibility. The other thing is in that case is that even these places are not safe. I mean, somebody was asking me yesterday, do you feel safe where you are? I don't feel, there's no safe place in the Gaza Strip. The Palestine Red Crescent Society is working, and I'm talking about in the whole of Palestine, on two things. First thing is the community services, where they're working on trying to help persons with disability be included within universities and colleges and schools and centers. The other thing is that some of them are getting sign language interpretation and sign language dictionaries in order to raise awareness for the persons with disability, for the importance of sign language. We've been also working on advocacy, which I think is the main important thing, is advocacy and awareness raising to the rights of persons with disability in Palestine. They're also working on inclusive education, trying to help, especially here, trying to help people who are unable to go to school, such as persons with hearing disability, in order to manage to get them at least to try to read and, as you say, activate their heads, the brains, so that they don't lose the educational opportunity. The PRCS has established PRCS camp, which is, of course, evacuation camp for persons with disability, especially hearing disability, in order to help evacuate them there and help. There's a lot of services within this camp, such as they're able to get communication through the internet. They're able to get accessible bathrooms.
Okay, thank you so much. Good day, everyone. My name is Brightfield Shadi. I live in Serowe, Botswana. I have intellectual disability and I'm an athlete of Special Olympics Botswana, and currently a volunteer at the Red Cross Society in Serowe, Botswana. My story shows that people with intellectual disability, they can play a meaningful role in their societies. For example, me, I have been trained by Red Cross to be a first aider, and also trained by Special Olympics to be a healthy messenger. I use those knowledge to benefit the people in my community. That shows that we are not disabled, but differently abled.